Hi, I'm Lacie, and this is an ankle assessment video. This is my patient, Kavria, and she hurt her ankle. So we're going to go through the steps: hops, history, observation, palpation, and special test. So for a couple questions, I would ask, what is Kavria's pastime activity? So does she work out a lot? Is she always on her feet, or is she seldom on her feet? If she's always on her feet, this could be an overuse injury. Or if she's seldom on her feet, it could be an acute or rapid injury. Then I'd ask her occupation. So if she is a mailman, she's always walking around. Where if she's like a IT support person, they're typically sitting in chairs on their computers. Damn it, dog. I would ask if this injury has happened before, because if she has hurt her ankle 5 times in her right foot compared to 0 times in her left foot, there could be some association with how she walks, the types of shoes she wears, or it could be genetics. I would also ask what type of shoes she wears, because if you wear nice supportive shoes that help your feet, it would be better than wearing flat sandals that give no support. I would also ask what type of surface she was on when she hurt herself. If she's on a hard surface like concrete or pavement, it puts more pressure on the joints, where if you ask like a soft surface like sand or turf, there's less pressure. The next question I would ask is, how did you hurt your ankle? So this is known as the mechanism of injury. This is important because knowing exactly how your patient got hurt will determine what type of injury could have happened. I would ask if there was any swelling or bruising when the injury first occurred. What was the first treatment planned? Was it rice, rest, ice, compression, and elevation? I would then ask what the severity of the pain was. So after the injury, was she still able to walk, or did she need to be helped off the field and or wheelchaired off? And then I continue to ask them more about the bruising and how long the pain lasted, and if there's still any pain. Alright, so the next portion is the observation and assessment part. This is where we're going to inspect and palpate Kavria's foot. So for the observation part, can I have you stand on your toes? Good. This shows that she can still put full weight on her feet and that it's not going to be as bad as we might think. Next, can I have you just walk down there and back to check your gait? We want to check the gait to make sure that she's not walking disproportionately or that she's walking within normal limits. All right, continuing on with the observation, we're going to look from the foot from the anterior view. We are looking for any deformities in Kavria's foot, so if there's an extra toe, if there's any bone sticking out, which there is none. We're also going to be looking at her nails, which are nicely done and well taken care of. We're going to look for any signs of blisters or ingrown toenails, which since she has her toes done, there are no ingrown toenails. We're also going to be looking for any types of fungus, so like athlete's foot. So there is no redness, there's no cracking. Does this hurt?
No.
It does not hurt. So no signs of athlete's foot. Then we're going to look at the spread of her toes. So that's just making sure that her toes can move without hurting and everything seems okay. Then we're going to look for the anterior tibial tendon, which runs right along here, and it does not appear to be ruptured or inflamed. Then we're going to look at the extensor tendon. So can I go ahead and have you toes to the nose? So it runs right along right here, and since her toes are up, it means that it is not ruptured. Can you resist my hand? And you can see that she is doing that, so it means that her foot is good. So moving on to the medial portion of the assessment, we will check for the longitudinal arch right here and Kavria's is not very prominent, which suggests flat feet. Flat feet could be the cause of the pain because having flat feet when run does cause pain. It also could be because of the types of shoes she wears, like flip-flops, since they have no arch supports. Then we're going to look at her deltoid ligaments. Her deltoid ligaments run right here on this side of the ankle. There's multiple. Most of them feel good. None of them are in pain. She's not giving me any dirty looks, so that's good. Then we're going to check her medial malleolus. That is this prominent bone right here. This is part of the tibia, so that looks pretty good. Nothing wrong there. And then we're going to check the tibial nerve, which runs down here. Can you feel me doing that?
Yes.
That means that she has complete responsiveness in her foot, which is good. That means that all the nerves are intact and that she can be able to do normal functions with her foot. Moving on, we're going to look at the posterior side of Kavria's ankle. We're going to check the Achilles tendon, which runs from her gastrocnemius and soleus down to the bottom of her calcaneus. Since her muscle is not rolled up in a ball, it means that it's still attached down here. Right here, it still feels strong and healthy. We're also going to check the peritoneal tendons, which run along the lateral malleolus right here. Since they're so connected, that means that everything is okay. So next we're going to have Kavria's supinate. So turn your foot this way, good. Then we're going to have her pronate, good. You can see how the tendons move, which are all good signs. You can put your foot down. Now I'm going to have you resist supination, good, strong. You can put your foot down. And pronation, good. The final side is the lateral side. So here we are searching and palpating for the anterior talofibular ligament, which runs just alongside the lateral malleolus. We're also going to check the lateral malleolus, which seems fine. The anterior talofibular ligament runs along here. The sides of her foot look good. All of her arches seem fine, and her foot looks good. So we're going to look at the plantar portion of Kavria's foot. This is to see if she has any calluses, if she has any plantar warts, which there are none, any blisters, which there are none. Kavria takes very good care of her feet because there are no calluses, which is really, really good. We're going to look in between her toes again. This is just to make sure she doesn't have any foot fungus like athlete's foot, and there's no cracking of her toes. They're actually pretty soft, so that's really good. Now we're going to look at her sesamoid bones, which run along right here. We're just going to feel to make sure that they did not shift, move, or cause her any pain. Then we're going to have her plantar effects. So can you take your foot and press a gas pedal? Good. So you see that her foot's moving and she is resisting my hand. Go ahead and stop. Then we're going to check her flexor hallucis, which is the muscle that controls her big toe. So can I have you move your big toe forward? Good. So she still has complete control of her big toe. And can I have you dorsiflex, so toes to the nose? Good. You can't really see it, but she did move her foot in a backwards direction. You can see her arches, and everything looks good. So next we're going to check Kavria's range of motion. Typically we do this with the gomiometer. However, I do not have one of those. So what we're going to do is we're going to measure the angles of her foot movement with 2 pencils. So first of all, the normal range of motion for her foot, dorsiflexion is 15 to 20 degrees, plantar flexion is 40 to 50, inversion is 25 to 35 degrees, and eversion is 20 to 25 degrees. So to measure that, you would put one here, and when she moves her foot, so go ahead and put your foot this way. You'd move it this way, and then that looks about 15 degrees, so I would say that's in normal range. For dorsiflexion, you would put it on the malleolus, right? Where's your malleolus? Right there. And you'd line it up with her foot, and then when she dorsiflex, go ahead and toes to the nose. you'd measure the angle in which she lifted her foot. That looks about right. Because I don't have an actual gomiometer, it's hard to tell what her actual angles are. Alright, so moving on, we're at the muscle testing portion of the assessment. First, we're going to check her anterior tibialis. So we're going to have her dorsiflex and evert her foot. So this just makes sure that right here is really strong. Then I'm going to have her resist my hand. So strength means that her muscle is intact and everything's good. Then I'm going to check her peroneus, longus, and brevis. So those move the side of the foot, so I'm going to have her resist going that way, and then resist going this way. Good. And then we're going to check her flexor hallucis longus, which moves her big toe. So we're going to have her push up with her big toe, and we're going to have her push down with her big toe. Good. And now we're going to check her calf muscles, most specifically her gastrocnemius, which is on right here. So by checking that, I'm going to push up on her foot, and she's going to push down on my hand. So we are moving on to special tests. So the first test is called the anterior drawer test. What you do is you take your hand on the heel of Cabria's foot, put one on top, and you pull forward to see if there's any sliding. There's no sliding. Her foot is still intact. So the next test we're going to do is the apprehension test. This test is the anterior talofibular ligament. We're going to have the patient plantar flex slightly and invert, check on the side, and the anterior talofibular ligament is good. So the next test we're going to do is the varus and valgus stress test. The varus is when a force from the outside of the foot hits it and the ankle bends inwards, which it is not, which is good. Then the valgus one is where there's a force from the inside and the ankle bends outward. Because of inversion, the foot naturally goes inward a little bit, but everything feels good. So the next test is called the MTP test. So it's like the varus and valgus stress test, but we test the first digit of her right foot. So what you do is you slightly put pressure this way to make sure her toe doesn't slide, and then you reverse it and you go like this. And her toe is very stable. So the final test is called the Morton's neuroma test. It occurs in the third and fourth digits of the metatarsal bones. So what you do is you just palpate for any pressure, make sure that there's nothing there, and then you're gonna slightly bend the pinky toe, the fifth digit, and the big toe, the first digit, together to see that nothing happens and her toes are going just fine. So her foot is okay.